Welcome to ReGen Hospital. Here are some important guidelines to help you and your family during your stay with us. We have facilities for the comfort of your stay at ReGen Hospital. In your room, we will show you around and how to use the call bell, TV remote control, bed function, communication board, colored waste bins, bedside locker, lights, medication cabinet, air control, kiblat, and others. Within the ward, you may access the family lounge, water dispenser, patient pantry, public toilet, refrigerator, and fire exits. Please note that food waste have to be discarded in patient pantry or family lounge. Cafeteria and surau are also available. Feel free to use our main lobby to meet up with your family and friend during your stay. Visiting hours are from 9 a.m. to 9 p.m. daily, including public holidays. No children below 12 years old are allowed in the wards. Visits are limited to 2 persons at one time. Please also note that therapy sessions canceled due to non-medical reasons will still be charged as scheduled. Meals will be served at breakfast at 6:30 a.m., lunch at 11:30 a.m., tea at 2:30 p.m., and dinner at 5:30 p.m. Food or milk for patients on liquid diet or tube feeding can be provided by the hospital based on our dietitian's recommendations. If your own supply or food will be used, please inform our nurses. Some patients may require infectious diseases screening upon admission. This may apply to patients transferred from another acute hospital or nursing home, recently discharged patients, or patients from high-risk areas such as ICU or HDU. Additional screening may also be required for patients with tracheostomy, urine catheter, wounds, invasive lines, or drains. If needed, the patient will be isolated in a single-bedded room for 24 to 48 hours until screening results are available. The patient will be removed from isolation only if results are negative. If positive, isolation will continue for a longer period based on the doctor's decision. Visitation during isolation is not advisable due to the risk of infection. If isolation care is required, please follow these important precautions. The patient should perform hand hygiene frequently. Visitors must do hand hygiene before and after visiting. Carers and companions must follow isolation guidelines and PPE requirements. They should avoid unnecessary movement in and out of the room. Visitors must inform the nurses before entering for PPE briefing. Keep at least 1 meter distance. Only 1 visitor is allowed at a time. Unwell visitors and children are not permitted. Visits are limited to 20 minutes. Fresh flowers are strictly prohibited. Hand hygiene is strongly advised before and after any action that increases the risk of infection, such as touching the nose or mouth, using the restroom, or touching wounds. During isolation, please wear a face mask when communicating with hospital staff. Only 1 companion or carer at any one time is allowed to stay with the patient in a single-bedded room or same-gender shared room. Carer or companion is advisable for high-dependency patient based on assessment by doctor or nurses. However, their role does not replace the duties of the nursing team in providing clinical nursing care during the patient's stay. Companion or carer are advised to bring their own pillow and blanket for overnight stay. Charges apply if hospital items are used. During procedures or therapy in the wardroom, carers, companions, or visitors may wait at the family lounge. No carer, companion, or visitor is allowed in the gym unless required by the therapist. No taking of photos or video recording is allowed during procedures. Your safety is our utmost concern. For fall prevention, a red tag indicates high fall risk. Always get help from our nurses when moving around. If assistance is needed or the patient feels unwell, please use the call bell. Bed rails or side padding must be raised when the patient is in bed. CCTV monitoring shall be used when indicated by nurses. We will be taking consent for taking photos and videos on your physical conditions and rehab improvements as clinical records. If you wish to leave the hospital for any reason during your admission, kindly inform our nurses in advance. Home leave shall only be granted by your doctor. Ambulance transfer or mobility transport is available if required, upon request. Charges may be applied. Should you or your family members require assistance to perform your religious rituals or require spiritual support, a preferred religious contact, feel free to inform our staff for assistance. We are committed to ensuring you receive the very best care at our hospital and in the community. At the end of your stay, we appreciate if you can share your feedback with us through our survey. If you have any feedback, please consult our patient relations staff or scan QR for feedback available in your room. Thank you for helping us create a safe and comfortable rehabilitation stay. We look forward to supporting your recovery journey at ReGen Hospital.